is Focus with Jack Caudill.
Good evening, I'm Jack Caudill. Welcome to this month's edition of Focus. This month we're talking about heart disease. Three guests with us to talk about that. Dr. Joseph Tuma, he is an interventional cardiologist with the Regional Heart Health and Vascular Institute. Zach Wermager, he is a cardiac rehab exercise physiologist with Regional Health. And Qusi Al-Haj, he is a heart patient from right here in Rapid City. Now, February is American Heart Month. The Centers for Disease Control and Prevention say that heart disease is the leading cause of death in the United States, killing more than 600,000 Americans every year. And the American Heart Association says cardiovascular disease kills more than 17.9 million people around the world every year. Dr. Tuma, we're going to start with you. We talk about heart disease, a pretty broad term. When we talk about heart disease, what are we talking about?
Yeah, I think when most people think about heart disease, the thought is it's coronary artery disease, so obstructive blockages in the coronary arteries that limits blood flow to the heart. But realistically, heart disease can include weaknesses of the heart muscle, valvular heart disease, any variety of things. So yeah, it's kind of a broad term, really.
Now, when we talk about statistics nationwide, worldwide, do we see those same trends here in this area that we see everywhere else?
Yeah, it's very similar. I think the one thing that's unique about the western part of South Dakota is we do have a higher incidence of diabetic patients. And so diabetes and heart disease kind of go together, and so our prevalence is a little bit higher, slightly higher than the national average, and people also tend to present a little bit later in their stages of disease here than some other places.
Is there a reason for that? Why we have, why they present later? Why we have more diabetic cases here than some other places do?
You know, I think it's partly the demographic, the patient population in the surrounding areas. There still are some limited access, I think, sometimes to healthcare or rapid healthcare, although that's improving dramatically and has gotten better, almost every year since I've been here. So.
Now, Zach Wermager, Jack, you're part of the cardiac rehab part.
That's right.
How does that fit into all of this? What is cardiac rehab? What do you guys do, and how does that fit into this whole process?
Well, after Dr. Tuma sees them, if they have any interventions or anything like that, we'll come walk them in the hospital. People who move in the hospital leave the hospital faster. They have faster recovery rates, so we educate them on diet and exercise there in the hospital as well. Working on starting that cardiac rehab program in phase 2. So phase 1 is in the hospital. Phase 2 is when they come down in the gym downstairs in the hospital, or you can see them up in, so there's one in Sturgis, Spearfish. They exercise monitored with us, and the goal is a lifestyle change, exercising for life instead of just for this 36 sessions you come with us. I don't think exercise can be understated how important it is with that diet and exercise changes, making sure that you make healthier lifestyle choices moving forward so you don't have to come back in and have further disease.
How much better outcomes do you see with people who throw themselves into that rehab program compared to people who don't?
We usually don't see those people come back to the hospital for stents as fast or if at all. We have patients that come down to cardiac rehab that have been there 30 plus years and haven't been back with new disease. It's about that commitment. If you come in and make the commitment, you can see pretty good results.
Now, Qusi Al-Haj, as we mentioned, from Rapid City, you are a heart patient. What's your story? What happened with you, heart-wise?
Yeah, so early last year, I was diagnosed with atrial fibrillation. That's when the heart is just not emptying the blood completely out of the system, which I found out afterwards that's one of the major causes of strokes if it goes undiagnosed for a long period of time. So after that was fixed, in the form of cardioversion, so to speak, shocked back into rhythm, I still had high blood pressure. I still wasn't feeling right, and frankly, it's some symptoms over the years that I've just attributed to growing older or having a stressful lifestyle or working hard. Then I was diagnosed with actually 2 blockages in the left side of the heart, and as a result, I ended up with two stents. And then, shortly after recovery, I was enrolled in phase 2 in cardiac rehab, and I was so pleased with what I saw. I mean, I could tell the difference from week to week on the progress that I did. And like Zach said, it wasn't just exercise; it's a total lifestyle that I've signed up for phase 3, which is basically for the rest of my life.
Now, when you were first diagnosed emotionally, what's that like when you finally find out this is a serious deal that we have?
Sure. Once you get over the initial shock and you start connecting the dots, and in my case, I mean, I was really a high-risk patient. I had a history of family cardiac issues. All my siblings that are my age and younger or older are on high blood pressure medication, on high cholesterol medication. Both my parents had the issue. I was not disciplined enough to follow a regular exercise routine. I was eating what I thought was healthy, but not anything close to what I'm doing right now. So I just realized that I'm given a second chance. I did not have a heart attack, which I'm considered to be a lucky one with the 2 blockages in the heart. So once I realized that I had my break, and frankly, my cardiologist got my attention by telling me the following. She said, my job is to keep you alive. Your job is to decide what quality of life you want to have. And that basically put control of my life back in my hand. I didn't feel pity for myself. I did not feel, that it's not fair. I was only 56 when I was diagnosed. I just looked at it as I'm lucky. I dodged a bullet, and now it's up to me what to do from here forward.
Now, Dr. Tuma, he mentioned that there were some warning signs that he kind of let go. What are those risk factors? What are those warning signs that people shouldn't ignore that realize it's time to go see somebody?
Well, the risk factors are fairly standard. So high blood pressure, diabetes, high cholesterol, smoking, and family history of premature coronary disease. So those are kind of the big ones. And so we've seen about a 30% reduction in mortality in the last 20 years with coronary heart disease, and a lot of that has to do with awareness. And so those symptoms that go along with that. The classic one is exertional chest pain or chest pressure. People often will say it's not a pain, it's a pressure. And so, but the key is it's an exertional symptom. So exertional chest pain, chest pressure, shortness of breath with exertion, those are all kind of the typical symptoms. Fatigue that's just out of proportion to your normal self or comes on rapidly, those sort of things. And so, those are really the primary symptoms. And if you start to feel those symptoms or you feel like something's not right, it's time to go in and discuss that with your physician.
How tough is it to get people to actually take that first step and not, that's just the way things are,
right.
to realize that I've got to go get this looked at?
Yeah, it can be tough. I mean, I think there's a lot of denial, I think, is part of it, or people tend to say, well, it's stress or it's something I ate, but if it's a consistent symptom that's not getting better, it's oftentimes progressive. I think people have to realize that nobody is necessarily safe, and we've seen in the last year alone in Rapid City, we've seen people from age 27 to 97 that present with a coronary syndrome. And so I think if you have those symptoms, it's by far the best thing to do is go in and get looked at.
Now, Qusi, you said you ignored a lot of this stuff for a long time. What was the point where you finally realized, I can't ignore this anymore? Yeah,
so I mean, once I was diagnosed with atrial fibrillation, then that just got the ball rolling with, let's get to the bottom of this and find out what's causing it. Why does my blood pressure, or why did it stay high? But in hindsight is 20/20. I had this heartburn that was, that I just felt constantly whenever I did even moderate amount of physical activity. Back pain, in the middle of my back, where I just feel like somebody just punched me in there, and it would just stay there. It's persistent, and often it gets worse with any physical activity. So in my case, again, maybe the atrial fibrillation was a blessing in disguise that led to the diagnosis. Otherwise, it would have been a heart attack.
All right, we're going to take a break, and we'll continue our look at heart disease when we come back with this month's edition of Focus. I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about heart disease. Dr. Joseph Tuma, he is an interventional cardiologist with the Regional Heart, Health, and Vascular Institute. Very long title you got there.
It is. We call it HVI.
Absolutely. That's much easier. How is the methods of detection and medication and treatment, how is that evolving over time? How much better are we now than we were 10 years ago?
Yeah, I think significantly better, and really the American Heart Association deserves a lot of credit for awareness. And people, there have been any variety of campaigns to increase awareness, and so people will present earlier. So the workup it depends on the patient. If they come in and they have what we consider somewhat unstable symptoms, chest pain at rest, or their initial EKG is very abnormal, sometimes we'll go right to an angiogram where we put a tiny little catheter, a long hollow tube up into the coronary arteries and inject dye and figure out what's going on. The majority of the time people have symptoms and we'll do a stress test. And so a lot of that depends on, on the patient, and there are different types of stress tests depending on the situation. But it's a way of increasing the patient's activity level in a very graduated fashion. And then we often will use either an electrocardiogram or an imaging test to image the heart and see if there are any abnormalities that would indicate a blockage.
Are there a lot more you can do now with medications, with surgery that you couldn't do before?
Yeah, I mean, so everything has evolved. The medications have gotten better. Our understanding of how aggressively to treat people has improved based on any variety of clinical trials. The technology has obviously evolved significantly, and things like coronary stents that we use today are 3 and 4 and 5 generations beyond the stents that I trained with, in my fellowship 12 or 15 years ago. And so everything's always evolving, and I think one of the big things is a shift towards prevention rather than treatment after the fact. I think that's going to be the where we go in the future with coronary and heart disease in general.
Zach Wermager is a cardiac rehab exercise physiologist with Regional Health, talking about cardiac rehab. How has that changed and evolved over the time to the point where you guys are now?
I think we've done more with preventative medicine as well, getting people in for phase 3. You don't have to start at phase 1 where you're in the hospital. You can come into phase 3 right off the street for risk factor modification. Fixing those things before they become a problem can be really helpful to keep you out of the hospital. People who come into phase 2 from phase 1, they stay out of the hospital longer as well, so they have better quality of life.
Now, when you say phase 1, phase 2, phase 3, what are you talking about?
Sure. So phase 1 is in the hospital setting after you get, if you have a myocardial infarction, we'll come up and we'll walk with you, do some education. Phase 2 is after you get out of the hospital. Once you're discharged from, you come down to the gym and we exercise you on a heart rate monitor where you have 3 exercise physiologists and a nurse watching over you. Kind of helps bridge the gap from the hospital stay to your normal, regular physical activities that you want to be doing. If you're a dancer or want to ride horse, people have a lot of fear about going back to their normal routine after a heart event because there's that fear that it's going to happen again. Cardiac rehab is great, and getting you there a little slowly, managing those expectations and getting you back to your normal and hopefully beyond what you were normally doing before, just to help move forward with that exercise program.
How much is that is mental to get them going and get them thinking positively and moving forward?
And that's the great thing about our staff is we're all very happy, positive people, but mentally, the people who don't want to get better or have excuses, make the excuses, don't come in. The people who want to get better come in, and then we can work with them and get them further on. So saying yes in the hospital to cardiac rehab is the most important thing you can do at that point. And coming in and really committing, like Qusi here, he did everything he could to get better. He changed, a lot of people think they're eating right. We have a dietitian on staff that'll help you get there. We do 18 different education classes to teach you what to look for in your diet and exercise plans moving forward so you don't have this happen again.
Now, Qusi Al-Haj, you mentioned you were regular down there in the rehab department. What has that meant to you? You said that is a much better way to go for you than getting on the treadmill at home.
Sure. And after having a cardiac event, you have this hesitation. You're unsure of yourself. You don't want to push it, because you're afraid you're going to have another event. So psychologically, it limits you. But you really need to be active, and you need to push your heart, so that you can, basically either maintain or even reverse a condition that you had, prior to the cardiac event. I can tell you this: I've been on the program for 8 months, and I'm in the best shape that I've been in 20 years. I mean, I can actually probably run 5K without any hesitation right now. I just feel that much better. There's good support staff, very professional staff. They'll push you, within, of course, what you're capable of. They'll push you to your capacity. but also there's a camaraderie that develops amongst other patients that come in, where you start holding each other accountable. You know, if I feel like I'm busy or I don't feel like I'm going in today, well, I'm accountable to Mike, whom I told I will see you on Wednesday, therefore I better be there. You know, it's human nature.
Yep.
And it's the reason why most of us do not exercise, because today is not a good day, I'll do it tomorrow. This provides a mechanism, really built-in accountability with great support staff, and it's for people that want to better their lives. I mean, and to me, after 8 months of the results that I have right now, I'm in it for the rest of my life. I don't want to go back to earn another T-shirt, because they give you a T-shirt after phase 2, and I just want to earn one T-shirt and it's already done.
How much of this was exercise? How much of this was lifestyle change?
You know, I don't really know. I mean, it's frankly, in my case, it's 3. I think exercise, exercise does crazy things to the way you think, because a candy bar after a long day used to be attractive. Now a candy bar, I think of a candy bar in terms of half an hour on the treadmill, right at 4.5 miles an hour. Is it worth it? You know, so really, the two are connected. And then you also start paying attention to the stress level. And you try to remove yourself with stress, from stressful situation, so that it doesn't, basically get you in trouble again.
Dr. Tuma, from the medical side, how important is what he's doing out there, getting the exercise, getting all of that stuff, to not come back again?
Yeah, I mean, it's critically important. We know from some of the actual data out there that cardiac rehab is associated with 30% reduction in all-cause mortality. That's a big number, and so improves medication adherence, improves patient satisfaction, the camaraderie he talked about, and so adherence to the medications, following diet and exercise, all those things are critically important to preventing second events. Like he said, one event's enough, and usually that's our goal too. We want people to, I like seeing everybody, but I tell them I prefer not to see you again on the table. I'll see you in the clinic, that type of thing. So. All
right, talking about how to prevent those second events. How do you prevent the first event? We'll take a look at that when we come back with this month's edition of Focus. I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about heart disease. And Dr. Joseph Tuma is an interventional cardiologist with Regional Heart Health and Vascular Institute. We talk about not wanting people to come back after having an event. What kind of prevention methods are there so we don't see you for the first time?
Yeah, so when we think of it, we think in terms of primary prevention and secondary prevention. So primary prevention is preventing the first event. Secondary prevention is preventing events after the first one. And really what it boils down to is modification of risk factors. And so if you're hypertensive, you need good blood pressure control. If you're diabetic, good diabetes control. If the cholesterol is high, that needs to be managed appropriately. Tobacco use is also an issue. And I think regular exercise, sort of sensible diet, which minimizes saturated fats and fried foods. More and more we're trying to cut back on carbohydrates, and then regular exercise, I think, are really the big ones. So.
How often do you see patients who come in and you realize we could have dealt with this 3 years ago and this would have been easy?
Yeah, it happens. I mean, it happens a lot. Where people will come in, their blood pressure's high, their cholesterol's through the roof, those sort of things, and some people know about it, but it's interesting because it's coronary artery disease in particular. It's not a problem until it's a problem, and so people can be completely asymptomatic, have no symptoms whatsoever until the plaque decides to rupture, and so they can go from no symptoms to having a heart attack in the blink of an eye, and so addressing that stuff before that happens is crucial.
Now Zach Wermager is with the Cardiac Rehab Department. He is a cardiac rehab exercise physiologist with Regional Health. You guys big on pushing prevention as well. What message do you put out there as far as to keep people from having to come in?
So exercise, it can't be understated. 30 minutes a day, 3 times a week is the minimum goal for exercise. And that's where we want everybody to kind of start. Too many people try to go back to what they were doing back in high school. They have been out of it for a while and they push too hard and then they get sore and quit. So we want to be something you can maintain in the long term. So even if you have to start off with 5 minutes a day, get up off the couch, go for a walk, just for that 5 minutes a day, that's going to be important to moving forward, starting off small, but getting to that 30 minutes a day, up to 5 times a week at 45 minutes. That's the best thing you can do, aside from managing those other modifiable risk factors, quitting smoking, managing your diabetes, those types of things can really help keep you out of the hospital, and keep you from having a heart event for sure.
How bad is smoking? Is that about as bad as it can get? 2
cigarettes a day can increase your risk of myocardial infarction or heart attack by as much as 8 times. So 8 times the risk for 2 cigarettes. There's no real, you can moderate cookies, cakes, and pies, but there's no real moderation for cigarettes, in my opinion. They narrow the vessels, they make your blood vessels stickier, or your platelets stickier. All of that increases your risk of having a heart event.
Now, Qusi Al-Haj, you've heard all of the preventative speeches. Now, what message would you have to people out there? You've been through this.
Yeah, I mean, my message to frankly anybody that's whether they're 40, 50, or older, it's in your hand. The lifestyle, a lot of it is choices. About the only thing that you have no control over is your genes. It's the genetics pool that you come from. But that's still, in some respect, that's probably the only side that's not fair, which means you have to work a little harder at it. You have to watch, what you consume for food. You have to maybe exercise a little longer than the average person that's blessed with good genes. It's all life choices with this. If I had to do it all over again, I would have made exercise a major part of my routine, and I would have definitely skipped the temptation of going for food that I knew when I consumed was not healthy.
Now, after all of you've been through, how appreciative are you that you've come out the other side and you're doing well now?
Yeah, absolutely thrilled. It just gives you a different perspective, and frankly, you use it as a reason to encourage others. In the culture here that we have, people are reluctant to come out and talk about medical issues that they have. But if I can help one other person and prevent him from going and giving business to Dr. Tuma, then I've succeeded. Then it's worth it.
All right. He's trying to put you out of business.
No, I take no offense to that.
Now, there's been a lot of talk lately about, talking about specific heart disease in women. Are there specific factors particular to women, specific factors particular to men?
Yeah, I think one of the things we hear a lot is that women are much less likely to have heart disease. And although that's true statistically, it's still the #1 killer in the United States of females. And so one of the things there's certain awareness that needs to be understood, and females can sometimes present a little bit differently. They may or may not have the typical, what we call typical symptoms of coronary disease, the chest pressure. They often present more with things like shortness of breath with exertion, or pain in their jaw, or pain in their shoulder. And so you just have to have a index of suspicion. But it's common in both females and males. I think that's one of the things that we need to understand.
As you look at research that's going on now, where are we going in the future? What is in development now as far as treatment, detection, prevention?
Yeah, I mean, I think the big ones are aggressive medical therapy, and then, as Zach said, I mean, primary prevention. That's where everything is shifting. And it gets so sophisticated, even down to gene therapy or genetic analysis, and that's in the present. I mean, there are a number of genetic markers we've identified, that we can identify people who are going to be at significant risk 10, 20, 30 years down the road for coronary disease, which opens the door to risk factor modification at a much earlier stage. So in my mind, I think prevention of coronary disease is a primary focus, and I think that's really where we're headed.
Now, Zach, as you guys push prevention, are you surprised sometimes? Do people know as much about that as they should? Are you surprised sometimes that people don't realize what they're doing is bad for them?
Right, absolutely. People come in all the time who have never been on a treadmill, don't exercise regularly, and they didn't know that was causing them to not feel great. I myself have genetic risk factors. My uncle had a CABG, or coronary bypass graft ×5 when he was 50. So that increases my risk. My grandma has coronary artery disease. So knowing what I know now, just like Qusi, I changed my diet as soon as I started working here, even more than I had thought I was eating well before. Exercising more regularly and monitoring my blood lipids and that kind of thing, just to do it for myself and try to live the lifestyle that I preach to other people as well.
Qusi, as you were forced to learn about this stuff, were you surprised at some of the things that you didn't know and some of the things that you didn't think about?
Sure. Yeah, sure. It's often you can justify it in your mind. So, what's a steak with a little bit of extra fat on it, what's that going to hurt? And you can just forget that that becomes a lifestyle. And I'm not putting a steak down, but I'm just using that as an example, or a stick of butter or anything like this. So, and it's everybody else's problem. I think that's the biggest issue. It's not going to impact me because I'm healthy. Other people have heart issues. I'm not going to have heart issue because, I park the car away from the office and I walk, the extra 100 feet. But it really is, I think in order to be serious about preventing cardiac issues, especially when you're at risk, it has to be a lifestyle change. You cannot just poke it with a stick. You really have to take it very seriously.
All right. You feel like you're in a good spot now?
A fantastic spot.
All right, we are out of time. We want to thank you guys for all coming in. Qusi Al-Haj, heart patient, great to see you doing well, and hopefully that will continue for a long, long time. Also, Zach Wermager, cardiac rehab exercise physiologist with Regional Health, and Dr. Joseph Tuma, interventional cardiologist, Regional Heart Health and Vascular Institute. And thank you guys for joining us. Thank you for joining us as well. Hope to see you again the first Sunday night of next month. Good night.